Mason families, as you probably have heard, there have been some updates to the quarantine process that came out from CDC Guidelines. So I want to walk you through what we know today so that our communication is as up to date as possible and you know what we know. So first of all, I just want to remind you how the process works. I think it's always healthy to understand the context. When the CDC makes a change to their policy, to their guidance or guidelines, that came out last Wednesday. That came out nationally. It was through a press release. ODH, through Governor DeWine's update on Friday, came out and said they're adopting the new CDC guidelines for quarantine. That then comes down to the Warren County Health District. The Warren County Health District then just sent us information this morning verifying that they are also adopting the CDC guidelines. So today you can imagine we're working through the details to make sure that we have everything in place so that we can support this process. Because remember, we as a school district don't quarantine people. We follow through with the guidance and the requirements from our local health department. So we just want to make sure we have all those logistics correct so that we can build confidence in our community through that process. And there's lots of logistics, whether it's attendance data and how that works in our systems to make sure it's communicated to the teachers and to the nurses and to everyone through the district. So just understand there's a lot of layers behind the scenes that have to come into play when we're looking at changes like this. So I'm going to walk you through it. In the summer of 2020, we were introduced to the concept of quarantine and what quarantine means. And you remember it was close contact, 6 feet, 15 minutes, 14 days at home. That was what came out this summer. And then just last week and then this morning, as we got new information, the quarantine process has changed. And you understand, as we live in a pandemic, we learn more through the data that's out there and the scientific evidence. And so things do change over time. It's an agile world and it's always changing. So we're always ready to change, but we want to make sure we do this well and that you're coming along with us in this communication. So if you look here at what's changed from quarantine, from what we've been doing to what's new. So the close contact definition stays the same. So it's still 6 feet, 15 minutes. That part is the same. Here's what's new, and I try to put the new in blue so it'd make it a little easier to follow here. So the first thing is we have 3 options now to the quarantine process. Option 1 is the same as it was before. It's a 14-day quarantine. Option 2, which we think, or option B, which we think will be the most popular option probably with most folks, will be a 10-day quarantine. So it's a reduction in days for the quarantine process. That's if you have no symptoms during that time. So just to be very clear, you must have no symptoms during that time. And remember, a close contact with all of this, when we're talking about this, is that you are within 6 feet, 15 minutes with someone that had a positive case. And then the option C, which has a few layers to it, is that it's a 7-day quarantine with a negative test that was taken within 48 hours of the 7th day. Basically what that means is you can take a test, get a negative test on day 5, 6, or 7 of your quarantine. Now remember, when we're talking about quarantine, if I have a positive case, close exposure, that's day 0. And then you count forward from that day to calculate your quarantine. So if your positive case was on a Monday, that's day 0. If that's when you had close contact with someone of the positive case, then you count forward those 7, 10, or 14 days. So as you're calculating that out. Now, I want to remind us that we have something separate going on. And that is something we're very privileged to be a part of. That's the Governor's Test Pilot Program that includes ODH, which is Ohio Health Department. It's Warren County Health Department. It's Ohio State University, Wright State University, and the Dayton Children's Hospital, working together in a collaborative with 10 school districts across the state of Ohio. Mason City Schools is fortunate to be in that study. The way that study works is that we are looking at school-based close contacts only. So that would be a close contact that happens inside of our schools, not on the basketball court or football field, but it's inside our schools. That's what we're studying. And there are 2 groups that are a part of this study. The first group is Group A, school-based close contact. If you're a part of that group, that means typically you would be in that 14-day quarantine or the 10-day quarantine. That's what you would typically be a part of. You've had a close contact within our school. And you have the option to participate in the study. Here's how the study works. If you're in this first group and you're in that quarantine group, You take 4 tests over 2 weeks. And we've told you a little bit about this, but I want to remind everybody because it's really important you understand that this is a separate piece than what's coming out with CDC, but it is an option in our school district. If you are in the comparison group, which this is a group of people that have volunteered. So these are families that said, this study is important, and we're raising our hand to volunteer to have our kids a part of this study. The kids that are in that comparison group test 2 times over a 2-week period. The difference between the 2 groups is this group had a close contact. They're the quarantine group. If they had a close contact and they test negative, then they have a modified quarantine, which means basically they can go to class, wear their mask, keep their distance, wash their hands, but then they're quarantined at home after school. So they're not a part of extracurricular activities for that 14-day or now 10-day period of time. That's how that works if you're in this group and you test negative over those 4 times. If you test positive, obviously you go into your 10-day isolation. That's the same always. Same thing with the comparison group. However, if you test negative, you don't have to go to a modified quarantine. You just have to go to your regular routines and continue on with your regular routines. So if you've not signed up to be a part of the comparison group, we would love for you to consider that, because the more data in the study, the more valid and reliable the study is, so that we can make decisions. Remember, all of this is looking at is a 3-foot distance in a classroom with controlled environment where there are masks 100% of the time on all of the participants in the classroom, and we have as much distance as possible, hand washing, we have hand sanitizer, and we're disinfecting the area. If that's working, which we think it is, if that's a safe environment, this study should show that, so that we can take a closer look at what defines quarantine from classroom settings. So we'll finalize with just a quick summary. You're going to see this graphic coming out, and this graphic goes through each of those with some more detail. So first of all, you have your 14-day quarantine, and what does that mean? That is an option for families if you get the call from the school and you're part of that close contact group. The second piece here is the 10-day quarantine. And so this goes through what does that mean for the 10-day quarantine. That's the new change from the CDC that has come all the way down to the local health district. And then finally, the 7-day quarantine. And what does that mean? The 7-day quarantine with a negative test. Remember, that negative test has to be taken within 48 hours of the 7th day, and we need to actually have your test results from your doctor or a doctor's note with the date of that test and the result before your child can get on the bus, before your child can come to school. We have to have that negative result if that's the route that you choose to go for. If that's not the route you want to go for, then you have the 10-day option, and obviously we always have the 14-day option as well. So this is the update, and I went through really quickly what the rapid test process looks like. So if you have more questions about that, let us know, and we'd be happy to connect you in. So I'll remind you of this as I end. All of this ties back to what we do as a district. Everything we do ties back to our culture guide. And in our culture guide, it says very clearly that we have to adjust and adapt on a regular basis. This is another example of how our district is adjusting and adapting, sharing with you very transparently how this process looks and works from behind the scenes. And I will remind you, all of this will be possible. The fact that we're still open after 20 weeks of school is because you're doing your part in wearing masks in our community, keeping your distance, washing your hands, continuing to encourage each other to do that. If this is working in our classrooms, it will work in your car, in your house, in any setting that you're in. This will work. It creates the barriers that we need during this pandemic. And to give you some hope, there is hope around the corner. We are not that far off. If we can just work hard for the next 2 weeks to get to the next break, and then we'll look forward to the next 2 weeks, and we'll keep chunking this away as a community, we can do this. So please help us stay open, help us stay safe by participating in either the study, making sure that you're always practicing the safe protocols that we have in place. If you have any questions at all, as always, please reach out.